Discover the benefit of Blue.
Thank you for joining us. Today you will learn about the following: details about the benefit of Blue, a brief overview about the ABCs of Medicare, an overview of our 2021 plan options available to you. We'll share extra benefits that you get that are not covered by original Medicare. And lastly, your event host will rejoin you for a live question and answer session. You may have seen the benefit of Blue in our advertising, but what does that really mean? To us, it means being there for our members and providing them with peace of mind during times of uncertainty. Help during a time of uncertainty. Today's landscape is different, and many seniors are among the most vulnerable when it comes to maintaining their health. That's why Blue Cross Blue Shield of Arizona is dedicated to helping our members get through this challenging time by helping them improve their health. We want to ensure that our members can access care easily, with doctors they trust, at a cost that's affordable. Here are some other examples of how we're supporting our members during these uncertain times. Our member services team conducted more than 9,000 outreach calls to our high-risk members beginning in March, and the calls are still ongoing. We enhanced benefits to include a $0 out-of-pocket cost for telemedicine visits with a doctor by computer, tablet, or mobile device. We also provided early drug refills and extended day refills on prescription medications. And to help our members stay active and engaged, we informed them about the virtual fitness classes available through the Silver and Fit program. We also delivered over 83,000 masks to our members to ensure they have access to a face mask to protect themselves from COVID-19. Finally, we're providing ongoing communications through postcards and mailers like the quarterly newsletter and sharing other tips and resources available on azblue.com/coronavirus. Another benefit of Blue is our promise to be there for our members now and always. For over 80 years, Blue Cross Blue Shield of Arizona has been serving Arizonans. Our plans have received high satisfaction ratings from our members for customer service and access to doctors and hospitals. We are proud of the strong reputation we have in the communities we serve. We look forward to being able to serve you as well. We all know that Medicare can be confusing, so we developed this next video to help you understand the different parts of Medicare and to learn more about the various options available to you. Remember to jot down any questions you may have so that you can ask us during our live question and answer session. Or you can schedule an appointment for a one-on-one meeting with your event host. Now that we understand the ABCs of Medicare, let's discuss the 2021 plan options. We have a variety of Medicare plan options available, and they include Medicare Advantage plans with Part D prescription drug coverage with a $0 or low monthly premium. Medicare supplement plans that include a diverse selection of options with monthly premiums starting at under $100. And standalone prescription drug plans that can be added to a Medicare supplement plan or original Medicare. Our prescription drug plans have a comprehensive drug formulary and access to over 50,000 pharmacies nationwide. Let's begin with the 2021 Medicare Advantage plan options. When you become a Blue Cross Blue Shield of Arizona Medicare Advantage member, you will receive a member ID card that looks like this one in your mail. Please remember to use this card instead of your red, white, and blue Medicare ID card when visiting any medical provider or pharmacy. We offer both HMO and PPO Medicare Advantage plan options. If you select an HMO plan, you must select a primary care doctor. Some specialists may require a referral from your primary care doctor. If you select a PPO plan, you can self-refer to doctors both in and out of network. However, if you select an out-of-network provider, your portion of the cost will be higher. To view a list of participating providers, please visit azblue.com/seniors and click on Find a Doctor. You can then search the doctors by name or specialty. Please note, network providers may change during the year. If you're unable to locate a provider, our team is happy to help you find a doctor in the plan's network. The Medicare Advantage plans we'll discuss today have a Medicare star rating of 3 out of 5 stars. We do have a few plans that are new and have not yet received a Medicare rating. The areas that Medicare reviews for star ratings include how well our doctors detect illnesses and keep members healthy, and how well our plans help our members use recommended and safe prescription medications. To learn more about Medicare star ratings, please go to medicare.gov. We will begin with the BluePathway HMO Medicare Advantage plans. These plans are available in both Maricopa and Pima counties. Please keep in mind, this is just a brief overview of our benefits. To obtain additional plan information, please contact your event host or enter your name and phone number in the secured chat box below to receive a benefit and enrollment guide. For those of you in Maricopa County, BluePathway Plan 1 is new for 2021. This zero premium plan gives you great coverage for the low cost and features a neighborhood network. Plan 3 includes all the coverage and benefits of Plan 1, but features a broader network of doctors and specialists for a $32 monthly premium. For Pima and Maricopa County residents, we also have BluePathway Plan 2. This plan features a zero monthly premium, wellness benefits, coverage for your preventative health needs, and a broader network of doctors and specialists. So what's included with the BluePathway plans? $0 primary care office visits, specialist copays that will range from $20 to $30 and are dependent upon which plan is selected, a $0 vision exam with a hardware allowance of $150 to $200 on select plans, $0 telehealth visits with Blue Care Anywhere, a $50 over-the-counter allowance per quarter, $0 routine physical and screenings, $10 copays for physical, occupational, and speech therapy, $0 cost for Silver and Fit home fitness kits and gym membership, access to chiropractic, acupuncture, and massage therapy, and a $0 routine hearing exam with a $0 rechargeable hearing aid upgrade option. For 2021, we are also pleased to announce that the maximum out-of-pocket costs for these plans were reduced and range from $2,900 to $3,400. The prescription drug coverage for these plans includes Tier 1 drugs at $0, Tier 2 drugs at $7, Tier 3 drugs at $40 to $47, Tier 4 drugs at $90 to $100, and Tier 5 drugs at 33% of the cost. We want our members to be their healthiest. For 2021, members can purchase a 100-day supply of all drugs on Tier 1 and Tier 2 for one copay. With BluePathway Plan 1, members will have access to facilities like Honor Health, Dignity Health, Tempe St. Luke's Hospital, and Abrazo. BluePathway 2 and 3 include a larger network of facilities that include Banner Health, Honor Health, Dignity Health, Tempe St. Luke's Hospital, Carondelet Medical Group in Pima County, and Abrazo. Next, we have Blue Medicare Advantage HMO plans, which are available in Maricopa and Pima counties and in portions of Pinal County. So what's included with the Blue Medicare Advantage Classic and Plus plans? $0 primary care office visits, $20 to $35 specialist copays, a $0 vision exam with a hardware allowance of $150. This allowance will vary by plan. $0 telehealth visits with Blue Care Anywhere, $0 routine physical and screenings, $0 routine labs, $0 cost for Silver and Fit home fitness kits and gym membership, and a $45 routine hearing exam with hearing aid services. Blue Medicare Advantage Classic and Plus plans include Banner Health and Honor Health facilities in Maricopa County. For those of you in Pima County, in addition to Banner Hospitals and Physician Network, members of this plan also have access to Carondelet Medical Group and Northwest Hospitals. For those in Santa Cruz County, we also have the Blue Medicare Advantage Standard Plan. The prescription drug coverage includes Tier 1 drugs at $0, Tier 2 drugs at $9, Tier 3 drugs at $40 to $47, and Tier 4 drugs at $90 to $100, and Tier 5 drugs at 33% of the cost. These plans also include a 100-day supply of Tier 1 and Tier 2 drugs for one copay. If you're an active adult residing in Arizona but travel out of state frequently, The Blue Journey PPO plan may be just what you need. This plan has a monthly premium and gives you the flexibility to choose from our widest selection of doctors and hospitals in Maricopa and Pima counties. But if you're spending a few months out of state, you can receive regular in-network care by utilizing one of the other 39 available Blue Plans providers. In addition, the plan provides $0 primary care office visits in-network and $40 out-of-network, specialist visits at $40 in-network and $80 out-of-network, a $0 vision exam with a hardware allowance of $200, $0 telehealth visits with Blue Care Anywhere, a $75 over-the-counter allowance per quarter, $0 allowance routine physical and screenings in-network, a $40 copay for physical, occupational, and speech therapy in-network, $0 cost for Silver and Fit fitness kits and gym membership, access to chiropractic, acupuncture, and massage therapy, a $0 routine hearing exam with a no-cost rechargeable hearing aid upgrade option, and this plan includes Banner Health, Honor Health, Dignity Health, Tempe St. Luke's Hospital, Carondelet Medical Group, and Abrazo Hospitals. The prescription drug coverage includes Tier 1 drugs at $0, Tier 2 drugs at $9, Tier 3 drugs at $47, Tier 4 drugs at $100, and Tier 5 drugs at 33% of the cost. This plan allows you to get a 100-day supply of Tier 1 and Tier 2 drugs at one copay. Let's take a look at the prescription drug stages. Regardless of the Medicare Part D prescription drug plan you select, it will have 4 stages of coverage. In Stage 1, if your plan has a deductible, you must pay the calendar year deductible before you begin paying copays. Stage 2 of prescription drug coverage is called the initial coverage limit, which increased this year to $4,130, which is set by Medicare. The initial coverage limit is a combination of both what the member and the health plan pays. Stage 3 of prescription drug coverage is called the coverage gap. In this stage, members pay 25% of the cost for both brand name and generic drugs until their out-of-pocket costs reach $6,550. During this stage, both what the member pays and whatever discounts they receive from drug manufacturers are applied to the member's true out-of-pocket cost. Stage 4 is a catastrophic phase, and the member will pay the greater of 5% for generic and brand name drugs, or $3.70 for generic drugs and $9.20 for brand name drugs. The Medicare Part D prescription drug benefit will reset every January 1st. Please note the listed covered drugs can change throughout the year. All of our Medicare Advantage plans include fitness memberships and home exercise programs through Silver and Fit. They also include hearing exams and hearing aid coverage through True Hearing, online telehealth, and a quarterly over-the-counter allowance on select plans. Please refer to the benefit summaries for each plan as coverage will vary by plan. When it comes to Medicare Advantage plans, we truly have something for everyone. From access to specific doctors and hospitals in your neighborhood, to broader access to even more doctors and hospitals, and plan options that range from zero to low monthly premiums. Now let's discuss Medicare supplement plans, also called Medigap, and how they can help cover some of the out-of-pocket costs that original Medicare doesn't pay, such as copays and deductibles. For Medicare supplement plans, you will want to present both your Medicare ID card and your Blue Cross Blue Shield of Arizona ID card for all medical care. We have 2 plan options: senior security plans, which include full Medicare supplement insurance coverage throughout the entire United States, no pre-existing condition waiting periods, and the freedom to see any Medicare participating doctor or specialist without a referral. We also have senior preferred plans with lower monthly premiums and an expansive Arizona network featuring more than 30,000 providers. No referral to see a specialist in network, and no pre-existing condition waiting periods. For senior security eligibility, you must have Medicare Part A and B, and you must be an Arizona resident, 65 years of age or older, and cannot have end-stage renal disease unless you meet the guaranteed issue right criteria. Blue Cross Blue Shield of Arizona offers a diverse selection of Medicare supplement plans. Each plan offers a different combination of basic health insurance benefits. Due to changes in federal law known as Medicare Access and CHIP Reauthorization Act, Medicare supplement plans will no longer cover the Part B deductible for those who become eligible for Medicare on or after January 1st of 2020. If you became eligible for both Medicare Part A and B prior to January of 2020, you will still be able to enroll in either Plan C or F. To be eligible for our senior preferred plans, you must have Medicare Part A and B, you must be an Arizona resident, age 65 years of age or older, and cannot have end-stage renal disease unless you meet the Guaranteed Issue Right criteria. Our Senior Preferred and Medicare Select Plan is available in Maricopa, Pima, Apache, Cochise, Coconino, Mojave, Pinal, and Santa Cruz counties only. If you're traveling outside of these counties, you are covered for emergency services only. Plan C is available for those who became eligible for both Medicare Part A and B prior to January 1st of 2020. And remember, due to changes in federal law, known as the Medicare Access and CHIP Reauthorization Act, Medicare supplement plans will no longer cover the Part B deductible for those who become eligible for Medicare on or after January 1st, 2020. If you became eligible for both Medicare Part A and Part B prior to January of 2020, you will still be eligible to enroll in either Plan C or F. When you enroll in a Blue Cross Blue Shield of Arizona Medicare supplement plan, you'll also receive preventive care services, hearing exams and hearing aid coverage through True Hearing, 24/7 nurse on-call service, access to Wellvy, an online surgery decision support tool, as well as fitness memberships and home exercise kits from Silver and Fit at no additional charge. Next, let's talk about our standalone Medicare Part D prescription drug plans. Blue Medicare RX is our standalone prescription drug plan. We have 3 plan options to choose from. All Blue Medicare RX plans have a Medicare star rating of 3 out of 5 stars. The value plan has a $31.50 monthly premium and a deductible of $445 on all tiers. After the deductible has been met, Tier 1 drugs are $0, Tier 2 drugs are $4, Tier 3 drugs are 25% of the cost, Tier 4 drugs are 44% of the cost, and Tier 5 drugs are 25% of the cost. The Essential Plan has a $39.50 monthly premium and a deductible of $180 for drugs on Tiers 3, 4, and 5 only. Tier 1 drugs are $0, Tier 2 drugs are $4, Tier 3 drugs are 18% of the cost, Tier 4 drugs are 40% of the cost, and Tier 5 drugs are 26% of the cost. The Enhanced Plan has a $105.50 monthly premium and a $0 deductible and a cost share for each of the drug tiers. The plan offers $0 copays for Tier 1 drugs, $4 copays for Tier 2 drugs, 18% coinsurance for Tier 3 drugs, 40% coinsurance for Tier 4 drugs, and 33% coinsurance for Tier 5 drugs. All 3 of these plans share the same formulary and a network of over 50,000 pharmacies nationwide. We've covered a lot of information today, from $0 and low monthly premium Medicare Advantage plans to Medicare Supplement and standalone Part D plans. Our Medicare plans were created to care for the unique needs of seniors. Each plan was designed specifically for different health and budget needs. Here are all of the options for Maricopa County. The good news is you don't have to be a Medicare expert to find the best plan for you. Your event host is available to assist you every step of the way. There are also many options for Pima County, from $0 premiums to out-of-state coverage for travel. Again, your event host is available to help you select the right plan for you. As a thank you for joining us today, we'll be sending a $10 prepaid gift card by mail to the address you provided when you registered. The gift card is redeemable at your neighborhood grocery store. Please allow up to 3 weeks for processing and delivery. So are you ready to enroll? Let us help you find the right plan. If you need additional information like a copy of today's presentation or an enrollment kit mailed to your home, please let us know. Thanks again for joining us today. Now let's turn it back over to your event host.